Hello and welcome to this video. In today's video I will answer the most frequently asked questions by the Dr. Germany YouTube community in order to get you more knowledge and information. If thereupon you have any questions, please comment under this video, post your question and we will reply in the next video on your questions. Let's come to the first question. Is there an acute shortage of international doctors in Germany? The shortage of doctors and other healthcare professionals in Germany was called acute by the president of the Medical Association of Germany. He said that medical care in many parts of Germany is under acute pressure and desperate finding suitable doctors and other healthcare professionals, as there's a huge lack of medical professionals in Germany. Reasons for that are that Germany cut short on the expenses of the education of enough doctors, as the medical education for one student for 6 years is at 150,000 euros, and for dentists it's even more expensive, it's up to 200,000 euros. So Germany, the government, tried to cut short on the costs, thinking short term, and they didn't educate enough medical students, medical professionals, because the costs are simply very high. At the same time, this combined with the fact that we have an aging society, more people live longer and are ill for a lot more long time. Also, medical science evolved, leading to the possibility that we can help more people who are ill, more people who have health issues. And then there's another side that the healthcare in Germany involved, because German people are more aware about their health, more aware of their aesthetics as well. So there's an increased demand here as well by the population for good healthcare system. And all those points combined led to the fact that we have a huge demand, a huge lack of doctors and other healthcare professionals in Germany. About 5,000 hospital positions for doctors are presently unfilled in Germany. The desperation goes so far that even in some areas in the hospital they use psychologists and give them the place of a doctor to fulfill certain kinds of work, because they simply don't have enough doctors. The second question I will answer is, how much does a doctor in Germany make? In Germany, salaries are regulated in the hospitals. So if you're a beginner, if you're an assistant doctor, a so-called Facharzt, you will earn at around 60,000 per year, which includes also the additional hours, night shifts and so on. And then if you pass your 5-year specialization process, you will become a Facharzt, a specialized doctor, and you will earn at around 80,000 euros per average. If you are a leading doctor, an Oberarzt, you will get paid around 120,000 euros, and if you're a chief physician, chief doctor, you will earn an average of 290,000 euros, in some cases even more. If you have your own medical practice, your own little office where you provide medical care, then you will earn at an average of between 120,000 to even 450, 500, 600,000 euro, depending on your specialty. The most highly paid medical profession in Germany is radiology, followed by ophthalmology. In Germany, in hospitals, usually you are promoted according to experience. It is regulated in Germany, so the salary is orientating towards your experience as a doctor. And in Germany, it is not allowed, it is illegal to pay international doctors lower wages, so you don't need to have to worry about that. Maybe in order to get chief position, you will have it harder. You need to work maybe harder than a German citizen, as you need to perfect the language and adopt a lot. But at the same time, due to the huge lack and demand, you will also have a great shot to high leading positions in Germany when you're motivated to do it. And there are many international chief physicians that are coming from abroad and that successfully made it to the chief position in the hospital. The third question I want to answer is, how long does it take in Germany when you study medicine in Germany to become a doctor? Well, the answer is 6 years. First of all, you do the preclinical part, it takes 2 years. Then you pass a big exam, including all the fields in the preclinical part. And then you come to the clinical part, which involves work with the patients. After, in total, 3 years of that, so including the preclinical part, 5 years. After 5 years, you have 1 practical year. It's called PJ, praktisches Jahr, practical year. And there you already work with patients in the hospital. You get paid a wage of very low, 800 euros per month. And you get experience while working as a medical student. And after 1 year, you pass another exam, another state exam, and then you are an official doctor. So you have 3 state exams, 1 after the 2 years of preclinical, then 1 after the 5 years of the 3 years clinical, and then you do your internship, your practical experience, practical year, and after that you pass an additional 3rd state exam, and then you are an official certified doctor, and you can start with specialization, which is always paid in Germany. Specialization is always paid. However, it is not an entirely well-designed program where you get guided, you write exams, etc. It is simply working in specific areas, and then after 5 years usually you pass 1 exam, and then you are an officially certified specialist. So this is how it goes. I hope I answered the 3 questions well and to your satisfaction. If you have any further questions, feel free to comment below. And if you need additional help to migrate to Germany, or if you want us to check your case, if you need any help with the process, we are there for you. You find the contact information in the description box below this video. See you in the next video and have a nice day. Marcel from Dr. Germany.